Yurika Strato is trying to check off everything on her bucket list.
There we go.
Strato and her wife Juanita spend as much time as they can camping at Silver Strand Beach in Coronado. Last year, they traveled all over the U.S. and drove up to Vancouver.
We took a week-long cruise up to Alaska, came back, we went to watch the FIFA Women's Soccer Final, you go USA. That was fantastic, you know. Well, let me just lift up first.
Strato has amyotrophic lateral sclerosis, or ALS. She can no longer walk, and she's losing the ability to use her hands.
Okay, watch my leg there.
Oh, yeah.
She's only 53 years old.
There we go.
Nonetheless, Strato isn't sitting around saying, "Woe is me."
Yep. I've always been a proactive, active person. I don't see the point in saying, "Woe is me," because it's not going to change anything. It's just going to make me and the people around me miserable. Put that little lever.
ALS is destroying Strato.
That's it.
Doctors have given her less than 6 months to live. She's decided she doesn't want to end up on feeding tubes, unable to take care of herself.
Because I don't have to suffer like a lot of other people have had to. I can say now and say, I'm done. You know, I've had a great life. I've been a very fortunate person, but I don't want to do this anymore. It's worse being alive than it would be not being around anymore.
We'll do whatever it takes to make you comfortable. And
Strato has told her doctor that sometime next year she wants to take advantage of California's new aid in dying law.
And you know, it's not easy.
No.
Her physician, Sunita Shailam, has agreed to give Strato a prescription for a lethal dose of drugs.
It's not for everyone. It's for people who have a terminal illness with a life expectancy less than 6 months. And anything that can preserve their dignity and prevent any suffering is important.
Strato's wife, Juanita, says she's fully supportive of her partner's decision to end her life before the disease takes total control.
And that's not because I don't want her to be around anymore. It's because I don't want her to have to deal with her body dying and have no ability to do anything about it and choke to death someday.
Because I know it'll be a big part of what people will be asking me about.
Caroline Boaz is an advanced practice nurse who specializes in palliative and hospice care at Sharp Chula Vista Hospital. It's her job to coordinate a dying patient's care and make sure that their physical and emotional pain are treated properly. Boaz says with the right kind of care, most dying patients shouldn't feel the need to take their own life. But
some people don't want to suffer through seizures and some of the things that can happen at the end of life. And I completely understand that, and I think it's wonderful that people will have a choice.
Yurika Strato says to be sure she doesn't want to die.
I'm a little scared, but where this disease is going to take me, if I have to live through it, scares me far more than death does, you know, because, boy.
Strato doesn't know exactly when she'll decide to end it all. Until then, she's just happy to spend time with Juanita, going down her bucket list. Kenny Goldberg, KPBS News.